Hello friends, today we are going to be talking about the axillary artery. We'll be talking about the structure, the branches, the origin and the termination of the axillary artery. We'll also be talking about the clinical relevance of certain branches the axillary artery has, as well as the positioning of the axillary artery to the brachial plexus. Now, the axillary artery has three main parts. You can call them part 1, part 2, or part 3, or otherwise you can call them as the suprapectoral part, the retropectoral part, and the infrapectoral part. Now, why is it important to know these parts? Is because each part has some branches coming off from them. So you will see later on when we'll talk about the branches why it's important to know the different parts of the axillary artery. Now, the suprapectoral part is the first part, which originates from the subclavian artery. Okay, and this happens when it crosses the lateral margin of the first rib. So as soon as it crosses the lateral margin of the first rib, it becomes the axillary artery, or otherwise the suprapectoral part of the axillary artery. Then the retropectoral part, it occurs when it descends behind the tendon of the pectoralis minor. Now, out of interest, what's the origin and insertion of the pectoralis minor? So it originates from the coracoid process and it inserts into the third, fourth, and fifth rib. So bear that in mind. Okay, so the retropectoral part descends behind the tendon of the pectoralis minor. And that leads us to the last part of the axillary artery, which is the infrapectoral part. This one is located between the inferior margin of the pectoralis minor and the inferior margin of the teres minor latissimus dorsi. Okay, so keep that in mind. It's important that you guys know not only the parts of the axillary artery, but also at which point does each part arise. Okay, so I gave you guys a quick snapshot of where you would tend to see in the different sections of the axillary artery. Obviously, these are not visible in dissection, so while you guys would be dissecting your bodies, for instance, you won't be seeing, you won't be able to identify each part of the axillary artery. So this is pure theoretical knowledge, okay, which you guys might be assessed under oral examination or under essays when you'll be writing your essays on SEQs and so on. Okay, so that would be all in terms of structure and parts of the axillary artery. Let's jump into the branches. Now, there are 6 branches that you need to know about, and when you learn them or when you recite them during an examination, make sure that you do that in order, starting from the first branch and you go down to the second, third, fourth, fifth, and sixth. Okay, don't start with the fourth branch and then jump to the first and second. Just make sure that you're showing that you have a good good organizational skills. Okay, and you do that by linking them, by saying them in order. So the first branch will be the superior thoracic artery, which is the branch that you're seeing right here. Okay, now that's one of the branches that arises from the suprapectoral part. Okay, and it's the only branch that comes from that part of the axillary artery. So remember that. So this is another reason why it's important to know them in order, or to know the parts of the axillary artery so they don't get confused. Okay, so if you start from the subscapular artery, for instance, which is the fourth branch, you could get confused and say that the subscapular artery arises from the suprapectoral part, which doesn't. So make an effort to remember each branch in order, as well as the different parts of the axillary artery. So going back, now the superior thoracic artery arises from the suprapectoral part. Now the second and third branches thoracoacromial artery and the lateral thoracic artery, those arise from the retropectoral part. Okay, so let's have a look at them. That would be your thoracoacromial artery. Okay, and this would be your lateral thoracic artery. Now, a important thing to remember about the thoracoacromial artery, so let's go back to it, is that it has a few branches which you need to know about. And those would be the pectoral branch, clavicular branch, deltoid branch, and acromial branch. So as the name suggests, the pectoral branch supplies the pectoral aspect, so they will be supplying also the pectoralis minor and the pectoralis major muscles. The clavicular branch, which supplies the clavicle. Deltoid branch, which will be supplying the deltoid muscle. And the acromial branch, which will be supplying the acromion. Now, going back, the fourth branch, your subscapular artery, which arises from the third part, also known as the infrapectoral part. And then you'd have your anterior circumflex humeral artery, which is found anterior to the humerus, and the posterior circumflex humeral artery, which is found posterior to the humerus. And you can see that the region that they are covering, or at least supplying, is the surgical neck of the humerus. And that's where we'll have to talk a little bit about the clinical relevance of these branches. So let's suppose that you were involved in an accident and you hit your shoulder and you broke the surgical neck of the humerus. So what would happen at that point is that you would be damaging these arteries because they're right next to the surgical neck of the humerus. So you'll be damaging them, you'll be breaking the efficient supply that the axillary artery is providing to this area. So that would lead to necrosis of the bone. So that's a point worth remembering in terms of clinical relevance of the axillary artery and its branches. Okay, so if you were to break the surgical neck of the humerus, that would lead to damage of the anterior and posterior circumflex humeral arteries, which can then lead to necrosis of the surrounding tissues as well as the humerus. So remember that. That's a very key important fact to remember. Now, the subscapular arteries also has two branches which are worth remembering, and those would be the circumflex scapular artery and the thoracodosal artery. Okay, now the circumflex scapular artery is very important because it's one of the branches that basically form the anastomosis on the posterior aspect of the scapula. There are few more that you need to know about. We'll not be talking about those today, but remember that one of the branches of the subscapular artery, which is the circumflex scapular artery, also forms the anastomosis on the posterior aspect of the scapula. Now, when it comes to the relevance that the axillary artery has with the brachial plexus is, I don't know if you guys have ever wondered why do the chords of the brachial plexus follow a particular style of names. What I mean by that is the chords are named as lateral, posterior, and medial. So what are they related to, right? So they're related to the to the axillary artery. So if this is your axillary artery, you'll have your lateral cord on the lateral aspect of the axillary artery, the medial cord of the brachial plexus on the medial aspect of the axillary artery, and the posterior cord right behind it. Okay, so that would be the relevance to the brachial plexus. Something worth remembering. Sometimes If you guys are assessed through MCQs, you'll definitely be assessed on this, so it's worth remembering. Okay, the lateral cord is found lateral to the axillary artery, medial cord medially, and the posterior cord is found posterior to the axillary artery. So that would be all in terms of the axillary artery. So today we talked about the structure, the branches. We talked about the relevance to the brachial plexus, and a little bit about the clinical relevance of the axillary artery towards the surrounding tissues and the humerus. So if you guys have any questions, feel free to drop them in the comment section below, and I'll try to answer them as soon as possible. So I'll see you guys in the next one then.